Hi, and welcome to the informational video webinar series on the rules for certified school-age child care centers. This is video number 7 covering behavior and guidance, prohibited discipline and physical restraint, and creating a climate for healthy child development. My name is Christina Christian. I work for the Office of Child Care as a regional manager in the Tualatin Field Office. The Office of Child Care hopes that you find these videos informative and supportive in learning about the new School-Age Certified Child Care Center rule set. During each video in the series, we will explain some of the key features and highlights of the School-Age Center rules. Another new aspect is that the rules have been organized differently to help make information easier to find. While we are highlighting many key features, changes, and new rules throughout this video series, the entire rule set will not be reviewed. Please refer to the School-Age Center rulebook for the full list of requirements and rules. Okay, let's get started. Behavior and guidance. A school-age center's behavior and guidance policy must include the use of positive guidance to help children develop self-control, self-direction, and respect for others through several approaches. Let's review the required approaches over the next few slides. Let's start by taking a look at two of the required approaches. Establishing simple rules and limits means setting and teaching simple, consistent, clear, and positive rules and limits that children can understand. On the right side of this slide, you can see some examples of simple, clear, positive rules. Reinforcing positive behaviors with encouragement and descriptive praise. The Office of Child Care has a technical assistance document that can help to support staff with reinforcing positive behaviors with encouragement and descriptive praise. The document is titled, "Tell Me What to Do Instead," and it provides examples on how to positively model behavior for children and gives examples of positive descriptive statements that acknowledge children's behavior and actions. Just ask your licensing specialist if you would like to receive a copy. Another approach that must be a part of the behavior and guidance policy is active supervision. Supervising actively is a proactive approach, which means to take steps to prevent problems before they occur and explain safe, natural, and logical consequences related to a child's behavior. The Office of Child Care also has two technical assistance documents available regarding active supervision. You can ask your licensing specialist if you are interested in receiving this information, or check out our website resource library. Two more approaches that must be included in your behavior and guidance policy are predictable daily routine and schedule, which means following a predictable daily routine and schedule with planned transitions, and setting up the environment for success with engaging activities that encourage positive behavior and self-regulation. Another approach to include in your behavior and guidance policy is understanding feelings. This approach means to help children recognize and appropriately express their feelings and understand the feelings of others. Additional approaches that must also be a part of your behavior and guidance policy are as follows. Modeling and teaching social skills such as taking turns, cooperation, waiting, treating others kindly, and problem solving. Redirecting or helping a child change their focus to something appropriate when their behavior is unacceptable. Prohibited discipline and actions. Next, we will review the rules and guidelines around prohibited discipline and actions. This can be difficult to review and even cause emotional responses and feelings to come up from past experiences and trauma. Please take the time you need to take care of yourself. You can pause the video and come back when ready. Please know it is okay to express emotions and feelings. It is also okay to talk to someone about your feelings and emotions. Above all, please be aware and take care. A school-age center must not use or threaten to use any prohibited actions even if requested or agreed to by parents. These include the following: rough or harsh handling of children or use of corporal punishment in any form, including but not limited to hitting, spanking, slapping, shaking, swatting, throwing, jerking, pinching, biting, or other measures that produce physical pain. Bind or restrict a child's movement unless permitted under the physical restraint section. Using unauthorized prescription or non-prescription drugs or chemicals for discipline or to control behavior. Confining or isolating a child in an enclosed or darkened area, for example, a locked or closed room, bathroom, closet, or box for punishment. Withdrawing, denying, or forcing food, rest, or toileting. Forcing or compelling a child to eat or placing soap, food, spices, or foreign substances in the child's mouth. Exposing a child to extremes of temperature. Yelling harshly or using profane or abusive language. Punishing or demeaning a child for toileting accidents or refusing to eat food. Allowing any form of mental or emotional punishment or verbal abuse, including but not limited to public or private humiliation, name-calling, teasing, ridicule, intimidation, making derogatory or sarcastic remarks about a child's family's race, gender, religion, or cultural background, rejecting, frightening, neglecting, or corrupting a child. Demanding excessive physical exercise, excessive rest, or strenuous postures, or requiring a child to remain silent or inactive, or removing a child from all activities or the group for excessive periods of time. Physical restraint. A school-age center must have written physical restraint protocols and implement such protocols only when appropriate and after complying with all requirements of behavior and guidance and prohibited discipline. A certified school-age child care center may decide that their policy is to not implement physical restraint. This is acceptable. A staff member must not use bindings, ties, blankets, straps, or heavy weights, including an adult sitting on a child, to physically restrain children. A staff member must intervene if they observe another staff member using inappropriate restraint techniques. A school-age center must document and report any incident when physical restraint is used. On this slide is an example of a form that a school-age program can utilize to document an incident of physical restraint. The Office of Child Care has created this support tool to assist programs with the documenting and reporting requirements of these incidents, including areas to document when they've reported to the parents and when they've reported to the Office of Child Care. You do not have to use this specific form, but it is required that you document and report any incident where physical restraint was implemented. Physical restraint must only be used if a child's safety or the safety of others is threatened and must be limited to holding a child as gently as possible to accomplish restraint, limited to the minimum amount of time necessary to control the situation, developmentally appropriate, and only performed by a staff member trained in the program's child restraint protocols. If physical restraint has been used more than once, a written plan with input from individuals who have knowledge of the child's behaviors must be developed to address underlying issues and reduce need for further physical restraint, if a plan is not already a part of the child's individual care plan. Individuals for creating the plan include, but are not limited to, the child's primary care provider, mental health provider, school counselor, and the parents or guardians. The program must notify the Office of Child Care that a written plan has been developed. All staff working with children must receive training based on the written plan. Required items to report to the Office of Child Care was covered in Video 5. As a reminder, school-age certified child care programs must report to the Office of Child Care within 24 hours or by the next business day the following items: anytime prohibited discipline or prohibited actions occur, and any incident where physical restraint is used. Please note that notifying the Office of Child Care of most of the incidents that were covered in Video 5, including those mentioned here, is not new, such as the serious injury of a child. But the time frame of reporting within 24 hours or by the next business day is a change. Mandated reporting suspected child abuse or neglect. Any staff member who has reason to believe a child has been abused or neglected is required to report the matter immediately, reporting to one of the following: the Oregon Child Abuse Hotline, the Department of Human Services Child Welfare, or a law enforcement agency. The Oregon Child Abuse Hotline number is 1-855-503-7233. This requirement applies 24 hours a day. This requirement applies to any suspected physical, sexual, or emotional abuse, child neglect, child endangerment, or child exploitation, inappropriate sexual contact between two or more children, or attempted suicide or threats of suicide by a child. Creating a climate for healthy child development. When communicating or interacting with children, a school-age center must ensure staff maintain a climate for healthy, culturally responsive child development. Over the next few slides, we will review some of the ways in which staff can support creating a climate for healthy child development. Using a calm and encouraging tone of voice, using positive language to explain what children can do and give descriptive feedback, having relaxed conversations with children by listening and responding to what they say. Adult conversations must not dominate the overall sound of the group. Greeting children upon arrival and departure at the program. Using facial expressions such as smiling, laughing, and enthusiasm to match a child's mood. Using physical proximity in a culturally responsive way to speak to children at their eye level. Validating children's feelings and showing tolerance for mistakes. Being responsive and listening to children's requests and questions, encouraging children to share experiences, ideas, and feelings, observing children and learning about their families, cultures, individual interests, ideas, questions, and theories, modeling and teaching emotional skills such as recognizing feelings, expressing them appropriately, accepting others' feelings, and controlling impulses to act out feelings. Being respectful of cultural traditions, values, religion, and beliefs of enrolled families, and interacting with staff and other adults in a positive, respectful manner. The Office of Child Care has created a tool to assist programs with implementation of these rules and identifying areas for goal setting, training, etc. Pictured here is the first page of this tool that covers the section on creating a climate for healthy child development. Over the next couple of slides, you will see the additional pages of this self-assessment tool. Here you can see the sections of the self-assessment tool that cover the activity plan and behavior and guidance. On this slide, the sections for program schedule, general staffing requirements, and play materials can be seen. A school-age center must ensure staff encourage positive interactions between and among children with techniques such as giving children several chances a day to interact with each other while playing or completing routine tasks, modeling social skills, encouraging socially isolated children to find friends, helping children understand feelings of others, and including children with special needs to play with others. Thank you for watching. This concludes video 7. You can now move on to video 8 in the series.